NCCN's mission is to improve the quality, effectiveness, and efficiency of cancer care so that patients can live better lives. Our vision is to be the world's leader in defining and advancing high-quality, high-value cancer care. NCCN was founded in 1995 to develop clinical guidelines and measure outcomes for the treatment of cancer.
At the first conference, we made very clear that the purpose of developing the guidelines was for the patient's welfare, that the patient was the center of this, that we wanted to standardize the treatment or at least provide guidelines for standardizing treatment so that we could learn more and also avoid side effects that might happen to the patient. As cancer therapy has become increasingly complex over the years, it is useful to have guidelines that give you a starting point. And changes can be made, of course, based on the judgment of the doctor, but having a good, solid place to start is extremely worthwhile.
The NCCN was launched in 1995 with 13 academic cancer centers working on 8 clinical practice guidelines. Today, the NCCN includes 25 academic cancer centers with more than 1,000 experts working on panels comprising 59 different guidelines. At the first meeting of the NCCN Breast Cancer Guidelines panel, we found a remarkable amount of agreement across the panelists at essentially all of the decision points on the guidelines. And that's a finding that's been repeated across multiple different disease sites and panels over the past 2 decades. Our ability to work together and reach agreement is based upon the fact that the NCCN clinical practice guidelines are evidence-based whenever possible. In addition, our panelists are leading experts within their disease site and modality.
Early on, we realized that we needed to effectively communicate the contents of the NCCN guidelines to the medical community. To achieve this, we wanted to create a robust continuing medical education program that focused on the NCCN guideline contents. NCCN's medical education program has grown from a single annual meeting to a wide variety of in-person and online accredited events around the world.
Under the leadership of Joe Simone, Bob Young, and the late Roger Wynn, we developed the Outcomes Database. After a year of work, the program launched in July 1997 with the Breast Outcomes Database. It then grew to cover 8 cancer sites, over 100,000 patients, and dozens of scientific papers looking at guideline concordance at NCCN centers and also looking at practice patterns and other forms of outcomes research, in particular looking at disparities in care at our centers. NCCN is developing its next generation of the Outcomes Database. This will streamline the efficiency of data collection and markedly expand the scope of the data that are collected, including use of natural language searching of the electronic health record.
In 1999, the Oncology Research Program was established as another effort to enhance research opportunities for our member institutions. Since that time, over 113 clinical trials have been developed, and that represents over $30 million of research funding made available to our investigators.
NCCN held its first policy summit in 2001. It was so well received that by 2009, NCCN instituted the NCCN Oncology Policy Program. The Oncology Policy Program now includes a patient advocacy summit. We convene regularly to discuss such subjects as biosimilars, off-label drug use, access to academic oncology practice, clinical trial design, and big data in cancer.
The NCCN disseminates information about the NCCN guidelines and about healthcare policy through the Journal of the National Comprehensive Cancer Network. Published quarterly, when the journal began in 2003, the JNCCN was rapidly accepted for indexing by the National Library of Medicine and gained market share so quickly among oncology publications that it is now published monthly and reaches nearly 23,000 oncology practitioners each month.
The NCCN Drugs and Biologics Compendium was truly one of the most important products ever put out by NCCN. And indeed, what we were looking to do was provide sound evaluative recommendations for patients through physicians, and secondly, to maintain and enhance physician autonomy and authority. And in 2008, both the United Healthcare program, the largest private payer in the United States, and the Medicare program recognized the NCCN Compendium, saying that if a specific drug for a specific indication was included as a Category 1, 2A or 2B, it would be covered. And that was critical because what it meant was that the NCCN panels were now directing the coverage policy of these payers specifically to the benefit of patients. And then extending that, in 2009, early 2010, we began on the Biomarkers Compendium, recognizing the impending importance of precision medicine.
Chemotherapy order templates allow physicians and the nurses within their office to much more safely treat our patients. It gives them information on doses, the route of administration, and supportive drugs to go along with the agents in the templates.
The patient guidelines were developed starting in about 2010. The purpose of the guideline for the patient is to give the information that are in our guidelines in a more simplified, readable form. If the patient brings that document with him to his oncologist, he will be able to ask more legitimate and accurate questions about his disease.
The NCCN Foundation was founded in 2010 in order to provide the parent organization, the National Comprehensive Cancer Network, which is the 25 biggest cancer treatment centers in the country, with funding for the patient guidelines and also for the Young Investigators Award. We've given 18 of them so far, and that is for these young academics and scientists who don't have a lot of funding yet. They're new in their careers. We provide them with funding, give them the opportunity to sit on the panels, and some of them have even matured to the point where they sit and chair panels on the NCCN to provide these really great scientific-based guidelines.
Over the 20 years, there's been a significant increase in the global use of the guidelines. There have been 5 million downloads of the guidelines this year, and half of them come from overseas. The NCCN has a number of educational programs worldwide. There is regional adaptation of the guidelines. They're translated in a number of languages.
In the future, the National Comprehensive Cancer Network will continue to advocate for choice and access to cancer care wherever appropriate and evidence-based. The NCCN will continue to lead in clinical practice guidelines, education, research, and healthcare policy to improve the quality, effectiveness, and efficiency of cancer care so that patients can live better lives.